Hi, everyone. Welcome back to another episode of Functionally Autoimmune. We have a fantastic guest on the show today. Joining me today is Jillian Cesarini. She is a registered dietitian, nutritionist. She specializes in glucose control, metabolism, and weight loss, and she is currently working with Nutrisense. Hi, Jillian. How are you?
Hi, Brandy. I'm good. How are you?
I'm doing great. Thank you so much for joining us today. There's so much information that is kind of out there with what you do, especially around glucose control. So before we get into that, can you kind of tell us a little bit about you and how you got involved in Nutrisense and just some background?
Yes, of course. A little bit about me. So growing up, I always had an interest in nutrition and fitness. I think this stemmed from the fact that my dad was a physical therapist. I was an athlete. So I was surrounded by a lot of people who were also interested in that. As I grew up, I became more interested in cooking as well. So it was natural for me to combine the interest of cooking and nutrition into dietetics. So I went to the University of Delaware for dietetics, and I graduated from there. I also did my dietetic internship there. And for my first job, I worked in a healthcare system in the South Jersey area in a very different field of nutrition. I was actually in community health, and I was a part of this program where we went into lower socioeconomic communities and provided discounted produce in an effort to improve food insecurity. And it was so different than what I'm doing now, but very rewarding. I loved it. It allowed me to be creative and, get to make like a real difference out there. But after 3 years of that, I wanted to do something a little bit different with my career. I wanted to work more one-on-one counseling people in a more like intimate setting rather than more casual conversations. At the same time, I became increasingly interested in the concept of metabolic health. I began to kind of put the dots together that so many of the health issues that we see today, whether that be diabetes, heart disease, obesity, dementia, all this stuff, all these lifestyle related conditions, what they have in common is that they're issues with metabolism. And starting to learn as well that, 1 in 3, 88% of Americans are not metabolically healthy. Diabetes is on the rise. So I knew that this was something really important that needed to be addressed. So when I was towards the end of my previous job, I became familiar with Nutrisense. And before even applying, I knew I wanted to be a part of the company because not only were they providing that experience I was looking for in terms of like one-on-one nutrition consulting, like coaching people to help reach their goals. But also they were tackling this issue that was so important to me, tackling metabolic health. And that's the mission of Nutrisense, is to, reduce the chances of these lifestyle related conditions from happening. So I applied and got in about a year ago, and I've been there ever since and absolutely love working there.
That's awesome. That's really amazing and such a fantastic background. So can we kind of go into Nutrisense a little bit as far as how does it work? Because I've heard of Nutrisense. It's out there. I'm sure most of the listeners have at least heard of it, if not seen an advertisement or something on social media that kind of alludes to Nutrisense. But can you go into a little bit of detail about exactly what the company does and how they help their members and things like that?
Yeah, sure. So Nutrisense is a health company that utilizes technology and expertise to help people reach their goals. And when I say goals, I really mean any health goals, whether that be more long-term health goals, such as reducing the risk of some of these lifestyle related conditions I previously was mentioning, or even more like short-term goals that I think a lot of us, can relate to, such as weight loss, energy issues, fatigue. We could help with all those goals. So really Nutrisense is for anyone who's looking to optimize their health. And when I say technology, the technology that we utilize to help people reach their goals is Cgm technology. And Cgm, it stands for continuous glucose monitor. And it does exactly that. It tracks your glucose continuously 24/7. And how it works is it's a sensor. It's about the size of 3 quarters stacked up on each other. It's a small medical device. In the US, you actually need a prescription to be able to get one. But at Nutrisense, once you sign up for the program, fill out our goals questionnaire, we cover that for you.
Wow.
So we'll send you, it's super easy. We'll send you the CGM, and how you apply it on is pretty simple. Take the sensor, the small medical device I was telling you about, and attach it to the applicator. And then the sensor that we use, the Freestyle Libre predominantly use, is approved to be put on the back of your arm.
Okay.
And all you do is push the sensor onto the back of your arm, and this tiny little microfilament goes just beneath the surface of the skin and measures your interstitial fluid continuously. So, and it does not hurt at all. It makes a little bit of a pop sound when you put it on, but it's not painful. You could work out with it. You could swim with it under 3 feet of water. I forget it's on there after I place it all the time, but it lasts for 2 weeks. It's only approved for 2 weeks. So after that, you'd have to replace it. So it's on your arm, and you you download our app, activate the CGM, and the microfilament takes samples of your interstitial fluid every 15 minutes. And that data gets transferred to our app, and you can see it like a graph. So you can see how your glucose is moving throughout the day. And you may think, well, why do I need to track my glucose continuously? I go to the doctor and I get my fasting glucose and A1C, and it's perfectly fine. Why would I need to know what's going on all day long? And it's a great question. And first, I do want to note that A1C and fasting glucose are very important to get, and everyone should do that every year annually, because it tells us a lot about our metabolic health and where we are on that trajectory towards diabetes. However, this is only fasting glucose and A1C is just a snapshot in time with what's going on with their glucose. It's not showing us how our glucose is moving throughout the day, how much it's spiking, how it's responding to food. And again, you might think, well, why is this important? Well, how our glucose moves tells us a lot about our metabolic health. And metabolic health, or metabolism, is really just how we process the energy from food. And you could think of metabolism like the engine of our body, right? And our metabolism really likes to keep glucose in this very tight range. It's a primary source of fuel. We like to keep it in a very tight range. And if there becomes issues with our metabolism, as we become more insulin resistant down the line, we're going to see larger swings and spikes with glucose. So by tracking our glucose continuously, we could see what factors are driving up glucose, swinging glucose, and contributing to lifestyle related conditions down the line. So really, we can kind of see what's negatively impacting our health early on, make those modifications early to reduce the chance of these lifestyle related conditions from occurring down the line. And not only is that helpful for, down the line, reducing risk of lifestyle related conditions, but we find that mitigating glucose spikes helps with lots of aspects of health, such as improving energy. It could help with weight loss and cravings, having more mitigated spikes. So it really is beneficial, again, to wherever you are on your health journey.
Yeah, and it's really fascinating one, that we have devices now that can do those kinds of things instead of having to prick your finger or do those things all the time. So that's really fascinating. But also, I think when people think of glucose monitoring, I think a lot of people kind of just associate that with diabetes. You only do that if you have diabetes, or if you have something that's like a blood sugar type of a condition that you have to monitor that. But really what you're saying is, now with these continuous monitors, you can do so many different things outside of even that with this tracking. And so if let's say you're tracking your glucose throughout the day, what are some of the interventions or lifestyle changes that you might be looking for, as far as, is it dietary? Can you contribute stress to certain spikes? What kind of things are you typically looking for?
Yes, that's a great question. So we're looking for many different factors can influence our glucose. The main factor is obviously food. Food is going to be the biggest driver of our glucose spikes. So by making modifications to what we eat, we could mitigate our spikes. And obviously the lowest hanging fruit that we all are aware of is reducing carb intake to some extent will help improve those spikes. But it's even more than just that. By making modifications to the meals that we have, such as eating a little bit of protein before, pairing that meal with more fiber, consuming that meal after a workout or going on a walk after a meal, we're going to see huge improvements in our glucose responses. And again, you wouldn't be able to know this by, taking a finger prick. By tracking your glucose continuously, you can see how making tiny modifications to your meals can make huge impact on keeping your glucose in the appropriate ranges. Yeah. In addition to modifying just the food that you're consuming, as you noted, stress and also poor sleep play a huge role in our glucose. So when we're stressed, we produce, the hormone cortisol, which drives up the production of glucose and reduces our insulin sensitivity. And this is, a natural response like this, our body, this is this is very natural. But if we're doing this continuously and chronically, this could contribute to insulin resistance down the line. And I think it's an interesting way to think of it too, is that with stress, evolutionarily speaking, we would produce more glucose and reduce that insulin sensitivity so that we'd have more energy to run away from, a threat like a tiger in the past. But in today's day and age, we're usually not running from something. When we're stressed, we're sitting at our desk. So we're producing more glucose, reducing this insulin sensitivity, but we're not like utilizing that glucose because we're just sitting there. So it could really contribute to negative, insulin resistance down the line. And one of the other main factors driving up glucose is also poor sleep. So a poor night of sleep can have a huge impact on driving up our fasting glucose and even reducing our insulin sensitivity. So they've done studies where they've, had people sleep deprived for 4 hours, and the next day their average glucose increased by 40% and reduced insulin sensitivity by 25%, which means that they have larger responses to the carbs that they're consuming. So stress, sleep, food, these all play an impact on, our susceptibility to developing these lifestyle related conditions down the line.
Yeah, for sure. So I just want to ask so that we kind of understand, because I'm sure people out there are wondering. So you have the continuous glucose monitor that you wear. So obviously that reads somewhere. So like you can look at an app or something like that and see that what that's tracking. As far as what to do with that data, do you guys offer coaching or are there resources? How do people know what their numbers mean and what to do with them?
Yes, great question. So earlier on, I noted when I was talking about Nutrisense that we're, a health company that utilizes technology and expertise to help you reach your health goals. And the expertise portion is the registered dietitian. So when you apply for Nutrisense, not only are you getting this technology to help you better understand your health, but you also get paired with a health coach, a dietitian. Yeah. And the dietitian is there to interact with you as much or as little as you want. Because, some people want to, do this on their own and others want lots of support. So we're there to help you wherever you're at. And the dietitian will assess your glucose data and provide you feedback on that. So the dietitian will tell you, okay, this is what's going on. And here's some ideas on how we could modify things to help support whatever your goals are. And I do want to make a note too, that this dietitian that you get, like the dietitian, I'm biased, but of course, but the dietitians at Nutrisense are really awesome. We all come from all different walks of life. Some have had experience in weight loss management, bodybuilding, sports nutrition. functional health, you name it. And we all share that information with each other. And it really helps us be really well-rounded. So we're not just like glucose experts, but
Yeah.
we just know a lot about nutrition. So, even if you have any other nutrition related questions outside of your glucose, we could help support you with that. And again, you can interact with us as much as little as you want. And I think a lot of people want to see a dietitian, but it's not the most accessible. It's expensive. It's kind of sometimes embarrassing to, go talk about this stuff in front of someone. But with our program, it makes it really easy because you could just pop in a question that you have, or you're looking at your data and you're like, I don't know what this is, and you'll get an answer. And it's really amazing.
Yeah, that's really great. And especially to get the support, because I know a lot of times, data is super powerful, and trust me, I'm totally a data person.
Mm-hmm.
So I get it. But a lot of times, when people get data, they just don't know exactly what it means. They know,
Right.
like, okay, I have this data, I know what I'm tracking, but I don't know exactly what to do with it. So it's great that you have that support system there for people, so that they have someone to talk to and get that information as well. And then typically, how long are you seeing that people are using Nutrisense? How long are the programs typically? What's the average that you see for someone to kind of go through their goals?
Yes, great question. So we have different plans. The minimum is 1 month. So if you sign up for 1 month, you will get 2 CGMs. And as I know before, each CGM lasts 2 weeks.
Yeah.
So if you sign up for the 1 month, you'll get 2 CGMs and complimentary dietitian support for that month. And then we also have longer programs, and the longer that you extend, the cheaper it is. So we could also do 3 month, 6 month, or 12 month. And yeah, it really varies. Some people are cool with a month if they're just trying to get a basic understanding of where they're at. They don't really have too many health concerns. But then, we have other members who really want to dive into some of these like deeper seated issues that they've been trying to work on for a while, and they may be with us for over a year. So I have some people who I've been working with for over a year now. So it really varies. It just depends on what you're trying to accomplish. And you could always just choose to extend on if you're, want to.
Yeah, for sure. And so do you ever have people who do have, chronic conditions such as diabetes and things like that, who really are just kind of struggling with, maybe they have done other things to try and kind of manage their condition, or their diabetes, and it's just they feel like they're not getting anywhere? Do you have people like that come in that are like, wanting really extra support, trying to get through those conditions, and really wanting to themselves closely monitor their glucose in a different way and have that support? Do you have that as well?
Yes. Well, I think it is important to note that we take diabetics, but not ones who are on insulin. So it's not like all of diabetics with us. But yes, we definitely have some people who really need a lot of extra support because, like, as you noted earlier, the glucose data, the information is one thing, and we can learn a lot about ourselves with just looking at how our glucose is fluctuating throughout the day. But, that only goes so far, and having that health coach there is a really important piece to helping people like establish habits to help reach their goals. And when I'm talking to some of my members, it's more than just providing information. It's like, okay, like, a lot of motivational interviewing, determining what things are going to be working for you and not working for you, and trying out different things. So we're constantly, depending again on how, much the person wants to utilize the dietitian support, we're constantly coming up with new ideas on how to work with your situation in a way that you can stick with to reach your goals.
Yeah, definitely. I love that. I think what you guys are doing is fantastic, because I do think that, again, data is important, and a lot of times that's kind of I guess the missing piece of the puzzle for some people, is getting that extra data. And so how would somebody reach out to you guys? How would somebody sign up for Nutrisense? Where would they find you? Can you share any of those details?
Yes, of course. So you could find us on our website, which is nutrisense.io. You could also find us on Instagram, Nutrisense.io, Facebook, and through there, we could provide you the information on how to sign up for our program and get you started.
Awesome. Sounds great. So I will definitely share all of that information in the show notes. So if anybody didn't get a chance to write that down, don't worry, it'll be in the notes for you. And then Jillian, thank you so much for joining us today. Do you have anything else about Nutrisense or about, metabolic health in general that you really wanted to share before we go today?
Yeah, I guess I could give just a few quick tips on how to mitigate your glucose spikes in order to, reach whatever your health goals are. I think just some of my few favorite ones is just try to name it real quick, making sure that you pair your carbs with a fat and protein. Trying not to eat carbs in isolation. Eating carbs in isolation, especially more processed ones, are really going to drive up our glucose response, make us not feel that great, increase our risk of developing lifestyle related conditions down the line. So making sure to always pair carbs with protein, fat is super important. Trying to target, higher carb meals around movement. After exercise, we are not going to have as large of a glucose response because after exercise, we clear glucose storage. We have room to soak in that glucose. Also, just go on a quick walk after a larger high carb meal can really reduce that, mitigate that glucose spike by sometimes up to 50%, just a quick 15-30-minute walk. Yeah. And again, just prioritizing sleep and stress. These really, they may not seem like a big deal in the moment, but like it really could add up down the line. It can snowball real quick. So making sure that you prioritize sleep and stress is also super important for keeping our glucose healthy and mitigated.
Yeah, definitely. I love all of those tips. They're all really great. So just real quick, can you give us, you were mentioning eating carbs with proteins and fat. Can you give us just kind of a sample, what a meal might look like? Like what type of thing might you eat to make sure that you're getting that all together?
Sure. So with a meal, I usually like to recommend to my members to, if you can, have, before diving into the pasta, having some fiber and protein before, and letting it digest for just a few minutes can really make a huge impact on the glucose response. So this could look like, a small leafy green salad with some olive oil and maybe just a few bites of lean protein, such as turkey, chicken, eggs. Eating this just a few minutes before diving into the carbs can make a huge impact on improving our response. With a lot of my members, it's different with each one, but I usually like to recommend to target, between 20-30 grams of protein per meal. I find that this works really well with mitigating glucose spikes and making sure that my members are satiated for multiple hours until their next meal. And so that's how I would normally recommend my members to approach a meal in order to help mitigate glucose spikes.
Yeah, that's awesome and really helpful. Thank you so much, Jillian, for joining today and for sharing all of your information and the wonderful data on glucose in general, but also what Nutrisense is doing and how that can really help you kind of reach your goals no matter what they are. Because glucose is something that we all have. It's something that is happening in our bodies all the time. So it's definitely great data to be able to harness and use. So thank you so much for sharing that with us today.
Thank you for having me, Brandy.
Of course. And thank you everyone for listening to another episode. We will catch you on the next one.